Hello viewers, I am Dr. Rahul Reddy, consultant andrologist from ANDROCARE Andrology Institute, Hyderabad. Welcome to our channel. Today in this video I will tell you what are all the problems we treat in our clinic and what are all the problems I am going to cover in our YouTube channel. So now first thing, I am an andrologist. Basically I am a urologist. I had experience in kidney transplants. Later I came to this field, which is a different field from urology. Now, what we will be treating in this field is first is erectile dysfunction. Now, most of the males, maybe whether they are unmarried people or freshly married people or old people, now this is a very common problem in most of the males. Which is called erectile dysfunction. So that means the ability to maintain or achieve or maintain an erection, which is called erectile dysfunction. This can be psychological, this can be a temporary problem, this can be a long-term issue. We treat all these issues. And second problem what we treat is ejaculatory dysfunction. Again, this is very common. 70% of males will have some sort of ejaculatory dysfunction. Commonest of ejaculatory dysfunction is premature ejaculation. That means people, they ejaculate very quickly when they try to have intercourse. If people are ejaculating less than 2 minutes time, then that is called premature ejaculation. And apart from premature ejaculation, there are certain other things which are very important in ejaculatory dysfunction. One is delayed ejaculation. Very few males they have this delayed ejaculation problem. That means they can't ejaculate quickly. They take half an hour, 45 minutes, which is disturbing for them because they can't enjoy their sexual pleasure. So that is called delayed ejaculation. Even we treat that. And third problem what we generally treat is anejaculation. This is very rare. 1 in 10,000 patients will have this kind of problem. This is called anejaculation. Anejaculation means people can't ejaculate at all. That means they can have erection, they will have intercourse, but they can't ejaculate. That is a very rare problem, but for the people who are having this is a nightmare because nobody knows. Even many doctors don't know what is anejaculation, how to treat. It's a different problem. And third issue what we deal is male infertility. So male infertility, it's like exactly opposite to female infertility. Now 70% of IVFs. So now if you see, there are so many IVF centers in India. If you see in metro cities, every street has a IVF center. But all these couples, there are thousands of couples who are undergoing IVF treatment for infertility. But 70% of these couples, they have male infertility. That means low sperm count or low sperm motility or abnormal morphology, sperm morphology, or some people they have azoospermia. That means zero sperm count. We deal with all those things. And what can be done is in these people where infertility, there is sperm related problems, in 60 to 70% of them we can make them normal. So these 60 to 70% of couples, they don't need IVF procedure. We can just they can get natural pregnancy, or sometimes if they reach IUI range, then they can go ahead with IUI range because there is lot of cost difference between IVF and IUI. IVF will cost you around 2 to 2.5 lakhs, whereas IUI will cost you only 5 to 10,000 rupees. So now even if you reach that level from IVF range, if you reach to IUI range, these couples will be saving lot of money. Stress will come down. Other problem what we deal is testicular pain and prostatitis. There's so many males who are suffering with testicular pain. In average, in my clinic, I see at least 7 to 8 patients coming to me with long-term testicular pain. That means, which is long-term means more than 6 months. They say always, doctor, I am suffering from this test. Like sometimes some patients come to me saying that, doctor, I am worried about this testicular pain. Please remove my testis. That is what they say when they come to my clinic. So there are various ways of treating testicular pain. Only antibiotics, just giving antibiotics and painkillers may not work for all types of testicular pain. And other problem, which is again very common in males, unmarried males, is prostatitis. So see, this prostate gland is just below the urinary bladder. This is seen in all males. This is only a male gland. So what happens is, normally prostate enlargement is seen after 50 to 55 years, which is normal age related enlargement. But What we are dealing here is prostatitis, infection or inflammation in the prostate. This prostatitis is a bothering issue for these people. I have seen most of the patients who have stopped working, just sitting at home because of prostatitis. So we deal with this. And last one is testosterone deficiency. Then there are so many young males who want to boost their testosterone, one for muscle growth and second one for sexual growth, so sexual improvement. But most of them are taking this over the counter medications and they are ending up with other side effects. So now I will we deal with all these things, and in our YouTube channel I will try to explain all these things. If I explain all those things, probably you should get around 70 to 100 videos. I will explain all those things, what are the root causes, how to treat, how to avoid these kind of problems, how to treat naturally, what are the simple homemade remedies for these things. So keep watching our channel. Please subscribe to our channel. We'll be posting videos on all these subjects which are useful for every male. At some point of your life, every male will face one of these issues that will be helpful. So please subscribe to our channel.